of health today. Rosy-cheeked, my guess is that you've gone through life pretty much the same way, and with good genetics in your family, my guess is you, Lee, and your family, your kids, have all been healthy also. So this is a hypothetical question that isn't about your family, but about a hypothetical Nebraska family.
Yes.
I understand you're concerned about medications being distributed by physicians who haven't seen those patients. But in your experience, within your constituency, is it reasonable for us to see a phone call coming to a physician's office saying, so-and-so, my husband, has been fighting this cough for several weeks, can you give him something to help him? Or the kids have got earaches again, we need the medication you usually prescribe for those earaches, and on and on. Do you see that as something that plays out in the state of Nebraska on a regular basis?
I imagine not on a regular basis. If the doctor knows and is familiar and trusts and has an ongoing relationship and history with the patient, perhaps, but in most cases, and I know at the Dinklage Clinic in West Point, that they want you to come in for a prescription. And one of the last visits I had done a lot of research on the illness, and the doctor said, so why are you here? And I said, I need a prescription.
Thank you, Senator Barrage. What I hear you saying is that you trust the physician and the physician's judgment in these matters. And so it gives me an opportunity to remind the body that the Nebraska Medical Association, the body that represents not all, but a majority, I think, of active practicing physicians in the state of Nebraska, or certainly at least a very large number, is supportive of this bill, using their judgment, their knowledge, and their training, that in the instances we're talking about with certain STDs, it's appropriate for them, without seeing that patient, just as not infrequently they prescribe other medicines for other diseases that they're comfortable doing without seeing the patient. The Nebraska Medical Association finds this appropriate. It alleviates the concern I might otherwise have that what we're dealing with here is something that is fraught with risk on behalf of patients. Certainly there is risk, as has already been discussed. Anytime you take any medication, there is risk. Even if it's stuff you buy over the counter, there is a degree of risk. However, you weigh that risk against the benefit. And in this case, we're finding the peer organization responsible for weighing this risk in the state, the Nebraska Medical Association, saying this is an appropriate risk to take, an appropriate thing to do. And therefore, didn't get a chance to say it before on the mic, I'll restate it now. I'm certainly in support of this bill, support of the amendment from Health and Human Services, still trying to weigh whether I'm in support of AM 764, but I think what it's attempting to do, improve education, is admirable. Thank you.
Thank you, Senator Gloor. Continuing on, discussion of Amendment 764, Senator Bloomfield.
Sorry about that. Thank you, Mr. President. Good morning.